Good evening, everyone. We are excited and welcome you to our very first social justice webinar. We have a few housekeeping items to review. First, the chat is open, so please feel free to type it in the chat box. Second, we have a Q&A period at the end, so please feel free to type your question in the chat for our speaker. Third, after the Q&A, we will have a raffle with some trivia questions. So if you pay close attention, you may win a prize. For those who may not be familiar with Victory Human Services, we are a 20-year nonprofit agency that provides in-home supports to seniors and individuals with disabilities in the greater Boston, Brockton, and Springfield areas. We believe that people are greater than their disabilities. Like I said before, the Social Justice Committee welcomes you to our very first webinar. This committee was created by our Victory Human Services executive team. Our members include Javita Kumber, representing the ABI MRSC team, Edwin Giotto, representing the AFC team, our two advisors, Evans Chiombre and Candy Ramos, and myself, Kenya Omeda, representing the Compliance and Quality team. The Social Justice Committee was formed due to the racial injustice uproar with police brutality. Most recently was the outrageous killing of George Floyd on May 25th of last year. Prior to then and since, many more Black and Brown people have fallen victim to these senseless police brutality across our nation. This committee's goal is to engage our members in their household and important events that take place in their communities and in the society. Our goal is to keep you informed, educated, and active by providing and assisting you in all areas of your well-being. Our very first initiative was a voting project. We wanted to ensure that everyone who was able and qualified to vote had the opportunity to do so. Now, in the state of the global COVID-19 pandemic, many Americans are facing substantial economic hardship. Latino and Black people experience these hardships at significantly higher rates than their white counterparts. The coronavirus pandemic also has spawned widespread mental health problems. Recent coronavirus survey data from the US Census Bureau show that 41% of US adults reported symptoms for anxiety and depressive disorders, compared to 11% in 2019. It is because of these social issues in our communities that the Social Justice Committee wants to bring to you experienced speaker Gary Giotto. Gary has worked for 24 years in the child welfare field as a therapeutic mentor, a specialized foster care social worker, a clinician, and a private behavioral health practitioner. He is a licensed independent clinical social worker in the state of Massachusetts. Most of his work focused on helping children, adolescents, and young adults who battle depression, anxiety, and trauma to reach a higher, healthier, and safer level of functioning. Research does show that children or adults who have experienced any form of trauma may have difficulty to proper social emotional adjustment. He also offers individual and group counseling for anxiety, depression, and intergenerational conflicts within the family unit. He speaks fluently Haitian Creole, French, and a little bit of Spanish. Un poquito. Gary has been a school adjustment counselor with the Brockton Public Schools for 20 years. Gary, we turn the time over to you now.
Thank you. It was such a wonderful introduction that really, really makes me, feel really good about myself, but at the same time, putting a lot of stress upon myself as well. Good afternoon, everyone. Again, my name is Gary Giotto, and I'm a social worker. I have an MSW, and I am a licensed independent clinical social worker. And I've been working basically with the Brockton Public School, with the youth of Brockton for the past 20 years. I've worked at different schools in Brockton, from the elementary, from kindergarten, all the way to of Brockton High School, where I have been working as a school adjustment counselor for the past 17 years now. So it's a pleasure for me and honor to be the first guest, I would say, of the Social Justice Committee of VHS. It's such a privilege for me to be here with you this afternoon. And I hope that the time that we're going to spend, it's going to be worthwhile, though. I just want to make a small rectification as far as the title of my presentation. Excuse me. Initially, I was thinking about, focusing on mental health issues, mental health disorders in the minority communities. But when I really thought about it after a while, and I realized that maybe I would be, it would be more beneficial to this group to talk about the symptoms of mental illness. Because as you have heard at the beginning during the introduction today, that 41% of people during this pandemic have reported, issues and struggles with depression and anxiety. And it has a lot to do with the fact that people are very isolated, people are disconnected to their social network, people cannot gather together anymore and spend time with their family, with their friends, with their loved ones. A lot of people have lost their jobs during this pandemic. Families have experienced a lot of losses too due to the pandemic. So all those factors have really contributed to this increase in people struggling with mental health issues during COVID-19. So based on that, I have come to the conclusion that maybe the best thing to do this afternoon would be to help you to identify, to learn to recognize the signs of mental illness around you and maybe at your agency and your personal life, among your family and your friends. So you know at least, what the signs are and what can you do to help out, to help your clients, the family that you service, and or maybe your coworkers and and your friends and families. So right now I am going to share my screen with you so you can follow along with me during this presentation. And at the end, there'll be a Q&A if you have any questions, and I'll be more than happy to try to answer your questions. But my understanding is I only have half an hour, about 30 minutes, so let's get going. And once again, thank you for inviting me. Let me try to share my screen with you quickly. Here we go. All right, so you can see my screen, right? Okay, very good. All right, thumbs up. All right, recognizing the signs of mental illness. So let me go over the objectives of this presentation. First of all, I want to go over the definition of mental illness with you. What is a mental illness? When can we talk about a mental disorder? How do we diagnose a mental illnesses? What are some of the symptoms of a mental illness? Because again, we're talking about, recognizing the signs of mental illness. So we need to know what it is. So that will be the definition part. And we'll talk also about the symptoms, how in general mental illnesses, manifest themselves. But also we will talk about the causes of mental illnesses. And as a cultural piece, since I am Haitian, I think at the end I will talk a little bit about, mental health perception in the Haitian community as well. So those are my objectives for this afternoon. Let's move on. So recognizing the signs is the most important step in managing mental wellness. The earlier we find that we identify them, the better it is for the client. Recognizing the signs of mental illness is the first step in the right direction. So if we don't know what the signs because very often we see in some of our families that people, you know, get to the point where they have to be hospitalized because they have become suicidal, or people are pushed to the edge and they happen to do something, very drastic that is harmful to themselves or to their family or to the community. And that's when everybody say, oh my God, I never knew that so and so was struggling with mental health or mental issues unless something really big happened. So as providers in the community, I think it's very important that this agency, the workers, the employees of VHS are somewhat educated about the different signs, the early signs of mental illness, so you can be at a better place to assist and help and direct the families that you work with. So recognizing the sign is the most important step in managing mental wellness. As the earlier we're able to identify the struggles, the signs, the symptoms, the better chance people have to experience successful treatments. So mental illness, also called mental health disorders, refers to a wide range of mental health conditions. We're talking about mental illness, we're talking about, or maybe mental health disorders, because they both refer to the same, they are interchangeable. They refer to a wide range of mental health conditions. Uh, Conditions that may affect your mood, your thinking, and your behavior. So mental health encompasses, thinking, your cognitive abilities, your ability to think and to reflect, may be affected by mental illnesses, meaning that when somebody is experiencing mental illness, depending on the mental disorder, uh, they may experience some distorted thinking. They're not right in their thinking. Sometimes people hallucinate. They hear things that are not there. They may see things in some extreme cases that are not there. They have distorted perception of reality. For example, somebody who believes that everybody's after them to get them. Some people may feel like, very negative about their life, about their future, that they will never amount to anything for some reason. And because of those negative thoughts, they ended up feeling really bad about themselves, feeling inferior, and they tend to behave in very negative way that may, affect their safety, their well-being, but also the safety of the people around them. So there was a somewhat of a connection here. There was an interconnections between thinking, feelings and behavior. So mental health can affect all three areas of functioning, and as far as your ability to think, your ability to reflect, the feelings that you are experiencing, as well as your behaviors and your actions. So important to keep that in mind. Mental illness is very common. About 1 in 5 adults uh, may experience mental illness in any given year. There is no exception to that. Mental illness can affect people, from the lower part of society, and all the way to the highest level of the socioeconomic level. So there is no, as I said, no exception. And mental illness can begin at any age. Some mental illness conditions may begin from childhood to later adult to the later adult years, but also we've seen some conditions also starting during the adolescence period of life. So it's always good to pay attention to the signs, whether you're dealing with a child, whether you're dealing with a teenager or a young adult, it doesn't matter. So the effect of mental illness can be temporary or long lasting, depending on what the situation is and what type of conditions that you are dealing with or someone is struggling with. Those conditions can be temporary, or they could be long lasting. And I'm going to talk a little bit more about that later on as we're moving forward. Excuse me. You can also have more than one mental illness at the same time. That's what we call in mental health comorbidity, where someone may have, they may be experiencing depression, but also anxiety at the same time, and be diagnosed with both. Certainly somebody can have, more than one mental illnesses at the same time. For example, you may have depressions and then a substance abuse disorder. That's what we call, when you hear people talking about people in the health field, mental health field, talking about dual diagnosis, where someone is diagnosed with a substance abuse disorder, but also, and they also on the other side, they are struggling with the uh, mental health issue as well. So let's look at some more statistics though. Um, if you're looking at on the left of your screen here, which is on my left, but maybe the right of the screen for you, um, we're looking at the 12-month prevalence of common mental illness, all U.S. adults. So what are the mental disorder, the mental health illnesses that are the most common uh, 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 among adults in the United States? And those conditions are the number one mental health condition uh, prevalent within the adult population in the US is the anxiety disorder. So anxiety is number one. 19% of the adult population here in the US is battling, anxiety disorders. Then we have depression as the number two. 1% of the population struggle with obsessive compulsive disorders, 4% with post-traumatic stress disorders, then 1% with schizophrenia, and then 4% are battling dual diagnosis, like I explained to you earlier, meaning that, substance abuse plus a mental health disorder or a mental health disorder. Now, 12 months prevalence of any mental illness, across different ethnic groups. Um, 21% among all adults, certainly, but 14% among Asian adults, 17% among Black adults, 17% among Native Hawaiian and other Pacific Islands, 18% of Hispanic or Latino adults, 19% of American Indian, 22% of white adults, 32% of adults who report mixed multiracial, and then a very vulnerable group here, 44% among the LGBT community, lesbian, gay, heterosexuals, and and the rest of it. So this population is, again, one of the most vulnerable when it comes to mental illness in the US. So it's very important, during the course of your work and the different families that you service, that you work with, that you pay attention to the most vulnerable population. We're talking about, the minority population, Black, Latinos, Brown, and LGBT community, because there are high numbers of within those populations that are struggling with mental health. Um, all right, so we're talking about, African American population. As you know, the African American population made about 30.4% of the US population. So it's a very small percentage of the US population. But interestingly, if you're looking at the numbers, what you see on the screen is 16% of the 13.4%, right, reported having mental illness in the past year. So that means, although that it's a small segment of the American population, but the numbers of people within the African American community battling mental illness is very high. So it represents about 7 million people within the African American population are struggling with mental illness. So here is the Bible. This is the Bible of the mental health care field. That's what we call the DSM-5. This is the most recent one. It's a diagnostic and statistical manual of mental disorders. This is the 5th edition. They also call it in abbreviated term the DSM-5. I mean, that's the as I said, that's the handbook used by behavioral health care professionals to make diagnoses. That's where you're gonna see a classification, the condition, the criteria, and that's the you know the book of preference, you know, within the behavioral health care community. That's where all the mental health conditions are listed, the criterias to diagnose someone with mental health disorders. All this information is classified in the DSM-5. So it's a very important book for mental health care providers. Uh, so when it comes to mental illness diagnosis, there are certain criteria that we have to keep in mind. First of all, we need to think about the number of symptoms present. So we also need to, the symptoms, they have to be of a, depending on the classification, depending on the disorder, the mental health disorder that you're looking at. For example, for somebody to be diagnosed with major depressive disorders, uh, they have to present at least five or more of certain symptoms. For example, they have to be in a depressed mood most of the day. They have to show loss of interest or pleasure. Uh, they have to show that if they're experiencing sadness for most of the day, a sense of emptiness, a sense of hopelessness, a sense of helplessness. They also having difficulty, going to the day, getting out of bed, going to school, going to work, etc. So that should be a change. That should mark a change from previous functioning. That's very important. Not only the number of symptoms, for each disorder is different, but also during the course of the disorder, there has to be signs that the person situation or functioning, it's getting worse. It's getting worse. Uh, um, the duration is very important. For example, to be diagnosed with a major depressive disorder, those depressive symptoms, they have to last at least 2 weeks, 2 weeks in a row, 2 consistent weeks. So with no interruption whatsoever. So the duration is very important. The number of symptoms is very important in diagnosing mental illness. Then also the symptoms they have to be clinically significant. They have to cause significant social occupational impairment. Exactly what I was telling you earlier. The symptoms, they have to affect your social functioning. They have to impair your ability to relate to others, to interact with others, to maintain relationships with people, your ability to perform your daily activities, meanings like going to work, going to school. um, and another aspect also very important in diagnosing mental illness is whatever episode that you are going through, it shouldn't be attributable to any physiological effect or substance or another medical condition. So in other words, someone who is showing signs of hallucination, uh, but we have to ensure that the person is not under the influence of a substance or chemical substance or alcohol or drugs or things like that. So there are certain conditions that have to be put together when you are diagnosing a mental illness. Um, so trying to move as quick as we can. So many people have mental health concerns from time to time. So that could happen at any time. I could be at a place of my life where I am feeling down, I am feeling depressed, but it does not last for long. It may last maybe a one day, maybe a few hours, maybe a couple of days. Some people suffer from, seasonal depression. Every time that the weather, the season changes, and mostly during the winter time, we see an increase of people, suffering from seasonal depression. Um, a mental health concern becomes a mental illness When ongoing signs and symptoms cause frequent stress and affect your ability to function. So not feeling well, being in a bad mood, being in a sad mood, it's not necessarily a sign of mental illness. It could be a sign of that you are, struggling, mental health wise. But in order for it to become a mental illness, the signs and symptoms have to last a certain period of time based on the description in the DSM-5, but also there has to be proof of ongoing frequent stress that affect your ability to function, that keep you from performing the tasks that you used to perform when you were healthy or prior to experience those symptoms. So mental illness can make you miserable, yes, and can cause problems in your daily lives, such as school, work, or in relationships. In most cases, symptoms can be managed with a combination of medication and psychotherapy. So, in general, people suffering from mental illness, if they, it's always recommended that they get services, they get help. You may not be able to help them yourself as an employee because that's not your domain, that's not your area of expertise, but you could always refer them because there is help out there. There are people who've been diagnosed with depression and anxiety, but they are involved consistently involved in treatment. A combination of psychotherapy and pharmacology, meaning therapy and medication. Have been very successful in helping people who suffer from anxiety and depression to cope and to be able to function every day, to go to work, to go to school, to maintain healthy relationship because they are consistent with your treatment. All right, so treatment is very important and consistency with treatment is very important. Some example of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, addictive behaviors, uh, and signs of and symptoms of mental illness can vary. It all depends on what kind of disorder the person is struggling with, and also other factors. Example of signs and symptoms include feeling sad or down. If somebody, a family member or client, a family that you work with, that you provide service with, you notice that they haven't been themselves for a week, for a couple of weeks. That's a red flag right there. Because if you're looking at the duration of the symptoms, it's a red flag. That may indicate that, this family or that person, that client of yours or that coworker may be struggling with, depression or maybe struggling with some level of mental illness. Excessive fears or worries, mostly during this pandemic, a lot of people, are struggling. A lot of people are scared of getting sick, of getting infected. A lot of people are grieving the loss of a loved one or a friend of theirs to COVID-19. Excuse me. And as I explained earlier, a lot of folks have lost their jobs. A lot of people haven't been able to socialize anymore, or maybe all their social life is related to social media in virtual meeting with friends and families. In the Brockton communities, uh, uh, the Haitian community, the Cape Verdean community, African American, Latino community in the city of Brockton, a lot of those folks are very religious people. They like to go to church, and mostly the elderly people. The church is their base, that's their foundation. And since the beginning of the pandemic, and I'm talking about my mother, who's an elderly who lives with me, she hasn't been able to go to church. And that's a big factor for her and for her mental health because church was the safe haven where she would go and meet other elderlies and pray together, supporting one another. But since the beginning of the pandemic, she hasn't had that. And it's a major problem for her. And she's not the only one. I think a lot of us, even younger generations, we are suffering from isolation, um, separation due to the pandemic. Extreme mood changes of highs and lows, withdrawal from friends and activities, significant tiredness, low level of energy, problem sleeping, detachment from reality, delusions, paranoia or hallucination, inability to cope with daily problems or stress, trouble understanding and relating to situations and people, problems with alcohol and drug, major changes in eating habits, sex drive changes, excessive anger, hostility or violence. You know, somebody who used to be very calm, very kind and nice suddenly is having fits of anger, and you're wondering what's going on, where's this frustration is coming from. And sometimes at work or at home in the family or in the community, people are taking their anger and their frustration out on you. But it doesn't really have anything to do with you. Suicidal thinking, we've seen also an increase, a 10% increase, I believe, in suicidal thoughts due to the pandemic, in addition to a rise in depression and, and anxiety disorders. So mental illnesses in general are thought to be caused by a variety of genetic and environmental factors. So it could be biological, uh, meaning that you have inherited those traits from other family members who may have suffered from, you know, mental illness, which may increase your risk. So if you have a family member, let's say your mom or your father or somebody in your family who have suffered from mental illness or mostly depression or anxiety or something else, so you have to be on the watch because there is a possibility that you may also end up developing this disorder. Uh, environmental exposures before birth, you know, exposure to environmental stresses, inflammatory condition, toxins, drugs, and you know, we've seen, you know, a pregnant woman who drank and smoked, and you know, so that may have an effect on, you know, on their baby, on the child, you know, in terms of developing some mental health complication later on in life. Brain chemistry, very important part too, because we've seen in this field many people who never really have experienced any significant traumatic experience in their lives, who've never been abused whatsoever, who seems to have a very normal life, uh, uh, you know, but still battling, having some serious, significant mental health issues. So there are times it is linked to the neurotransmitters. The neurotransmitters are, you know, naturally occurring, you know, chemicals in our body that carry signals to the brain. So when those chemicals are impaired, they're not functioning well or properly. So what happened, that may lead to depression and other emotional disorders. That's when medication comes into play. I mean, I'm not a big fan of medication myself, but however, for having been that long in this field, I've seen so many situations where pharmacology, medication have made a big difference in people struggling with mental health. Certain factors also, maybe, you know, risky factors that may increase your risk of developing a mental illness. You know, mental history of mental illness and a blood relative. As I said earlier, I explained that before. Stressful life situation, like the situation that we're going right now with COVID-19. It's a very stressful time for everybody. Financial problems can be the trigger. A death in the family can be the trigger of mental illness. A divorce also can be a very strong trigger of mental illness. And ongoing chronic medical conditions such as diabetes and other medical conditions also could be triggers that of mental illness. Brain damage, um, traumatic brain injury, you know, violent blow to the head, traumatic experiences such as military combat. We've seen a lot of vets suffering post-traumatic stress disorder, PTSD, because of exposure and trauma from the combat field. The use of alcohol or recreational drugs can trigger mental illnesses. Childhood history of abuse, of neglect, you know, kids who've been physically abused, uh, uh, emotionally abused, and also sexually abused, may at some point in their lives, you know, when those issues start surfacing, may start showing symptoms of mental illness. People who are isolated, who do not have a lot of friends, they don't have a good social network. People who are not who are involved in very abusive relationship, uh, who have previous mental illness or sexual abuse. Now, what do we do? Well, is there any prevention? How can we really prevent mental illness? Well, there is no sure way to prevent mental illness. However, if you have a mental illness, there are things that you could do, steps that you could take to control, your level of stress. Very important. Again, some of us are doing very stressful jobs. So we need to take care of ourselves. Self-care is very important. You need to encourage your clients to take care of themselves. So you need to take some step to control your stress. There's a time for you to put everything aside. There's a time for you to go on vacation, a time to give yourself a break, a time to do some meditation or reading or prayer, or whatever works for you. Maybe going to the gym, exercising. And those are things that conversation that you should be having with your clients as well, and encourage them to be involved in those types of, relaxation techniques. Increase your resilience, boost to low self-esteem. Um, but it's important that we pay attention to the warning signs. Sometimes you may want to work with your doctor, your therapist, or maybe encourage your clients to talk to their doctors if they are showing signs of, mental illness, if they are showing signs that emotionally, psychologically they are struggling. So you may recommend that they talk to their primary care doctor. All right. Uh, and involving other family members of friends. And if you notice that they are struggling, talk to the other family members and let them know that you are concerned with your client, because you feel that you're not diagnosing your clients, but however, the fact that you are sensitive to the signs, you may share some of your concerns and make some recommendations that they talk to a professional. So taking good care of yourself, it's very important when it comes to mental health. You need sufficient sleep. A lot of people don't have enough sleep. A lot of people, I don't know about you, but when I don't have enough sleep, I don't feel the same. My brain doesn't work the same. I feel cranky in the morning. Healthy eating habits, eating healthy, regular physical activities are important. Going to the gym, and start getting nice out there. Invite your clients, your family to go out for a walk, go to the park. Again, I know it's COVID time, but there are certain things that we could do. I mean, I've seen people going to the park with their mask on, walking around, walking in their neighborhood with someone. So there are, you know, activities out there that people could do to just get some fresh air, um, get routine medical care. you know Checkups are very important. Make sure that you go to your physical, on a regular basis. You don't miss out your medical appointments. Very important, not only for staff, but also, again, for the families that we provide services to. Mental health condition can be harder to treat if you wait until symptoms get bad. Again, that's why we're talking about recognizing the early signs of mental illness. The earlier we start addressing the symptoms, the better, the higher chance we have to succeed. So detecting early signs of mental struggles is the best thing to do. It's the step in the right direction, because that makes treatment way much easier and less complicated. Now, I'm about to finish in maybe a couple of more slides. I want to talk a little bit about the mental health and what happened in the Haitian community. Since I'm Haitian myself, I wish I could have enough time to talk about Cape Verdean community, the Latino community, African American community. However, we're gonna find some commonalities between all these different minority communities. So I'm gonna talk a little bit about Haitians. Haitians in general, they don't like to ask people for help. And I think Edwin can tell you that, or maybe the other Haitians who work at the VHS. Haitians, they only seek for help in time of crisis, when things are really, 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 really bad. So that's when they're gonna, try to reach out for help and seek help. And in the Haitian community in general, people are not receptive to the notion of therapy. So it's kind of hard to have Haitian families buy into getting into psychotherapy, because there is that perception that things stays in the family, right? You don't bring a stranger into your family business. That's family business. So we can take care of ourselves. We don't need a therapist to talk to. So they are very, very resistant to the notion of therapy. If I'm not mistaken, I mean, I believe it's the same in the Cape Verdean community and some of the Latino community as well, because as a school adjustment counselor with the Brockton Public Schools, I've seen it over and over again. So another threat in the Haitian community, problems are minimized. You know, it's never too bad. It's okay. You know, we'll be fine. There's a tendency to intellectualize and rationalize problems, according to Chassagne, you know, in the Haitian community. Haitian have a say like God is good, bon Dieu bon. You know, when they're facing crisis or they're going through a tough situation, you try to help them out. And sometimes you will hear that response, bon Dieu bon, God is good. In other words, don't worry about me. Don't worry about my situation. God is in charge. God will take care of me. So basic needs takes precedence over alleviating emotional distress. Again, and I think it's true for most of the immigrant communities, and mostly the ones who haven't been living here for a long period of time. So people are in a survival mode. They're not thinking about alleviating emotional distress. What they're worrying about the most is how am I gonna meet my basic needs? Housing, food, you know, education. So that's what they are most interested in. Now, as far as emotional well-being, psychological well-being, that would come after. All right. Um, you may find a lot of Haitian families, they don't a lot of Haitian people in our community, they don't like to take a break. They don't like to use their sick days. And I know a Haitian man was working, and he was a custodian in working in a hospital in Boston, and he was priding himself as somebody who's never take a sick day for a long period of time because he's such a great walker, but not realizing that it's taking a toll on his body, but in his mind as well. So you would hear Haitians say, you know, I can't afford being sick. Who will take care of my children and my family? In other words, even if I'm struggling physically, mentally, I can't stay home. I can take time to go to therapy. I can take time to rest because my family needs to be fed. So I cannot afford being sick. And unfortunately, what happens sometimes, by the time that they break down, they really need help, it might be too late, or too much damage has been done to the body, but also to the mind as well. So therapy, uh, you're gonna notice that, you know, Haitian clients, they will go to therapy unless they are somewhat forced to go by a third party. Sometimes it's because the school realized that there was a problem with the student, there was a problem with this kid, so they're putting pressure on the family to get the kid services, appropriate services, because the hospital referral, or because of the Department of Children and Services, DCF is involved in the case, and part of the service plan, the family has to be involved in counseling. So that's when you're gonna see, you know, some move where Haitian family feels that they are forced now to get help, to get services, either for themselves or for their children. Excuse me. Um, why? Because they might see therapy as irrelevant to their needs. Therapy is not part of their needs. They have better things to worry about. They have to send money to their family in Haiti, you know, so they have to work hard. They're working two, three jobs. They have no time for what they call nonsense sometimes. And when kids are struggling in some families and they're struggling with they're having experiencing emotional distress, and you hear parents say, oh, it's because they are too good, because they have everything that they want, everything that they need here in America. That's why they are depressed. I don't have time to be depressed. I've heard those comments over and over again. So be aware of those barriers. Um, so it's all about obtaining the basics for survival: housing, medical care, employment, and then some of our people too. They are not documented. They are undocumented. So there's always this fear of deportation that is always hanging over their head. So that's why they don't want to be involved with the authority. They don't want to go to therapy. They don't want to be involved with strangers because they don't have, you know, appropriate documentation. So it's important when you're working with the Haitian families that you're aware of all those factors and you take them into consideration as you're providing services to them. All right, so let me see. So when it comes to how people experience pain in every culture, it's I mean it's different. The way that Haitian people or Latinos or Cape Verdeans or African American, uh, you know, how they go about getting help from outside provider it varies. It's different sometimes, although that we may find some commonalities. Uh, so there is multiple belief. There are multiple belief systems as far as when people turn to outside for help. Uh, um, we for the sake of time, when people experience pain, that's when maybe they may be open to get some help, to get some support. But again, the experience of pain from one ethnic group, from one cultural community, may be different from another one. What may be painful for a Haitian family may not be painful for a Latino family, or maybe for a white family. But also, what they label as symptoms to symptoms of illness, symptoms of mental health issues may vary from one community to another one. The way they communicate about their pain and their symptoms, the beliefs about the causes of their struggles. I'm going to let you, since we are talking about Haitian community, I'm about to finish. Since we're talking about Haitian communities, uh, uh, very often in Haitian communities, when somebody is sick, whether it's a medical condition, whether it's a mental health issue, there is that belief in within that community among a lot of Haitians. Not all of them, but a lot of them, they tend to believe that there is some supernatural cause to somebody's illness, whether it's a physical illness or a mental illness. So, people think that this thing is being caused by a spell, you know, because within this community also there are beliefs, voodoo beliefs. Some Haitians believes in voodoo that people can do certain things to them, can cast spells on them using voodoo tricks and things like that. So when someone is not well, uh, you may find some family who may think that no, they don't need to go to the doctor. I know what the problem is, and they tend to turn to their voodoo priests for advice, for remedies, for medication and treatment. So be aware of that. And the overall attitude towards doctors and therapists and in some people, some minority groups, and sometimes rightly so, like we're seeing for the COVID-19 vaccine. And a lot of minority communities are struggling to take the vaccine, to even believe that the vaccine it's good, because there is this distrust of the system, this distrust of the doctors, of the scientists, and as I said, rightly so, because of things that happened in the past. Uh, how they've been victimized in the past by the system. Uh, the treatment they desire or expect. This book, it's a very good book when it comes to working with the different minority groups or different groups, different ethnicity in the United States. I recommend this book to you by my Dr. McGoldrick. It's the Ethnicity and Family Therapy book by Monica McGoldrick. It's a very good book. It talks about Haitian families, history of immigration, and the family dynamic within different groups. Uh, uh, Italian, Portuguese, Asian, all those different European, Caribbean, African ethnic groups in America. It's a wealth of knowledge and advice, and I'm really encouraging you as providers, VHS as providers of services in the community, and also the employees to maybe to acquire that book, Ethnicity and Family. So I think for the sake of time, I'm looking at the time, it's almost 4 o'clock, and I think I would be on the time that I was given, but as you can tell, I couldn't do better than that in terms of managing the time because it's such a very important subject, and I'm so passionate about it. So I hope that this presentation was, helpful to you, that you've learned something. I hope that it raises your awareness of the different symptoms of mental illness, that you are better equipped now to identify, some of the symptoms around you, at the workplace, at home, but also within the families and the different groups that you work with, that you provide services. So once again, thank you for inviting me. And it was a pleasure spending this time with you. So now I think I'm up for questions or comments, and thank you for your attention, your undivided attention. Thank you.
Yes, thank you, Gary, for this presentation. We are all excited about the whole topic, and then I think you did your best to manage the time. We understand it was about 30 minutes, but the topic is such an important topic, and we understand that. So the time is flying. We thank you for the presentation, and we have a lot of questions in the chat room, but I will take at least one question. And I will tell you, all of you guys, all the attendees, you'll still be able to post your question on Yammer. You can email us the question. You can even reach out to Gary, who's at the end. We'll post his email address on the chat room as well, where you can follow up with him and ask some personal question related to the topic. But I have one question for you, Gary. Now that restrictions are being lifted and more people are going out, some people are going to be experiencing social anxiety. Can you give us 2 or 3 tips on how to handle social anxiety? Because we're going back to normal, we're going to phase 4 and all of that. How can you address that? Can you give us 2 to 3 tips how to handle that?
Well, first of all, we need to acknowledge it's about validation. And I think what I mean by that is, validate those feelings and asking people about how they feel. For example, at Brockton High School, where I work, for the past couple of weeks, kids have been returning to school, to the building. Teachers have been returning to the building. And some kids have been, feeling a little bit uncomfortable, with the process, readjusting to the school environment, also worrying about getting infected as well. So I think the first thing to do is to validate those feelings, meaning acknowledging them, that they exist, right? They are legitimate feelings to have after being in confinement and isolated for such a long period of time. So validation is very important. But also we need to reassure people that, that they're gonna be all right, that they're gonna be okay. It's gonna take them a little time to get reacclimated to being in a certain setting. But more importantly, I think we need to remind them that the virus is still out there. The virus is still out there. The coronavirus is still out there, and people are still getting infected. People are still getting sick. So what I'm seeing around, it's a lot of people are letting their guard down because and again, it's springtime, it's beautiful out there. And so I think we need to remind people it's very important that they continue to take care of themselves, that they continue to protect themselves. Meaning what? Meaning wearing a mask at all times, mostly when they're outside and in public setting, but also keeping social distance as well. And I think that's what I would recommend. And if somebody feels uncomfortable, to be able to talk to someone about it and explore the reason why they are feeling uncomfortable. But acknowledging those feelings, I think that's the most important thing to do. So people don't feel weird because they having some social uneasiness in certain settings. All right, Edwin.
Thank you. Thank you for this answer, Gary. And I believe as we posted your contact information on the chat room, we're gonna email you all those questions, and then people get to them. So to make the follow-up with that, and then I'm about to turn it over. If you stop sharing now, Gary, I'm gonna turn it over to Jovita. which she's going to cover a few items with you. And let me turn it to Jovita for the trivia aspect of our presentation. Thank you.
Sure.
All right. Thank you. Thank you to our presenter, Gary, for the wealth of knowledge you have shared with us, and we'll take it back to our daily lives. Now we've come to the fun part, the trivia questions. Please use the chat box feature to answer all the questions. Evans will be announcing the winners for today. Again, use the chat box feature to answer the trivia questions. What will you be winning today? It's our limited edition exclusive VHS social justice t-shirts. Very well designed by the social justice team and printed by our very own local printer. It is an exclusive t-shirt, limited edition. Now let's jump to the fun part of the trivia questions. Are you ready, ladies and gentlemen? I guess you are. First question. Victory Human Services is celebrating a huge milestone this year. What milestone is that? Use the chat box. Use the chat box. You have 30 seconds. You have 30 seconds to win your very own exclusive social justice t-shirt.
We have a winner. We have a winner. The first one to answer that question was Leandria Branto. She was the first one to answer that question. The second one was Richard. So we go to the next question. Thank you.
Congratulations, Leandria. Congratulations. Our next question. What month do we celebrate Black History Month? 30 seconds. Use the chat box. Use the chat box. Congratulations to our first question.
Already. We have a winner. The winner is Richard Ward. Actually, Richard Ward won the first one too. So she answered the first one correctly and the second one correctly. I think she's just fast at typing. We have several winners, but Richard Ward is the winner for the day. Thanks.
Congratulations, Richard. We will definitely send you your t-shirt, and congratulations to our participants for today, even though you didn't win, but thank you for participating anyway. Now I will hand it over to for a closing remarks. Thank you, guys.
Thank you.
Thank you, Jovita. And then I'm very excited for the people who run those t-shirts. And then we are trying to be fair here. I believe we have 3 winners. We were prepared to give away 2 t-shirts, but people can type that fast, and we're very happy about that. This is the time, guys, to say thank you to each and every one of you for attending our first webinar as the Social Justice Committee at VHS. We want to thank the VHS management. We want to thank HR for their participation and support, the Social Justice Committee, the design company that helped us with the t-shirt, the caregivers who attended this session, the speaker of the day, Gary. We want to thank you for being with us. We want to thank you for delivering the message to us about mental health. And we are sure that you will come back one of these days for a second session. And as we mentioned, if you have more questions, please email us those questions, and we can, or email Gary, as we have his email address on the chat room. We thank the speaker of the day. We thank all the attenders. We thank each and every one of you. So we have the time to say thank you. Thank you for being with us. Thank you for attending this webinar. That was the first one, not the last one, but we will come back by next month. We will keep you posted on Yammer. We'll keep you posted on our website, on our email system to continue to educate you and having the Social Justice Committee working with you. If you are interested to be part of the Social Justice Committee activities, please feel free to email any of 5 of us. Either Candide, our advisors, you can email them, or you can email Kenya or myself or Jovita, please, because we have many t-shirts we want to give away. We want you to partake in that new journey at Victory Human Services. Thank you everyone for attending. The time is flying. It's exactly 4 p.m. So we say thank you again. Thank you for being with us. Until next time, thank you, Gary. Good luck with you for the rest of the year. Thank you in your private practice, and good luck to you. And then we'll see you until next time. Thank you, everyone. Bye-bye.
Thank you.
God bless.
Yeah.
Thank you. Thank you.